So here we are. This is the introduction, but we have recorded it in the end, so I can actually tell you that I am excited. There's many people I would like to thank. This course sort of amazed me because I thought it was trivial to talk about myofascial techniques today. Since everybody talks about it, I thought it was a little out of fashion because, as I said, it's very common. But I'm passionate about joint mobilizations, and we did our best. We collected the knowledge of different experts, and we gathered in only one course all the most important myofascial techniques. I have a degree in physiotherapy with full marks, and I'm also an osteopath. I tried to make things as easy as possible, not just for experts, but also for novices and beginners. So it's trigger point techniques, myofascial techniques, and joint mobilizations all together. So let's get a little bit more into detail here in the course. I can confirm it was a very long work, especially trying to put together the palpatory anatomy, the myofascial techniques, as well as the trigger point techniques, and the joint mobilizations. The palpatory anatomy itself is a meta course, it's like a course in a course. So we introduce the palpatory anatomy at the beginning of every video, so to make all the passages as easy as possible, I believe that the palpatory anatomy is at the base of every single course. We cannot make a course if we don't know the anatomical structures we are touching, especially when we are doing joint mobilizations and myofascial techniques and trigger point techniques. We must be more than aware of what we are touching, what we are palpating and mobilizing. Whether the course will be useful for novices or expert, I believe novices will find it very useful too for what refers to palpatory anatomy, and then to move on to the mobilizations, whereas the experts might learn a lot more because there might be some techniques that they didn't know. Let's now see in detail what's the content of the course. Speaking about palpatory anatomy, joint mobilizations and functional release, the functional release is made up of two sub-techniques, the trigger point techniques and the myofascial techniques combined. Of course, I wrote a detailed manual, and I also added a part that if I think about when I started, I would have paid anything to have it. I'm talking about some technical data sheets for trigger point myofascial techniques as well as joint mobilizations, condensed all together in one data sheet. So every single part, every single joint has its own data sheet. We will find also the description of the techniques, the contraindications, that I actually advise you read them very carefully, because it's very few contraindications, but I suggest you keep them in mind, as they are very important when you put your hands on a patient to mobilize the joints and to apply these myofascial techniques. So we divided the main contents in two parts, mainly the first part dedicated to the joint mobilizations of the TMJ, cervical, dorsal, lumbar, shoulder, elbow, wrist and hand, pelvis and hip, then the knee, ankle and foot. Second part instead is dedicated to the functional release. So we have the treatment of trigger points as well as myofascial techniques. We have combined them, and we have explained them in all the joints that we mentioned above. So the first part is usually anatomical. We analyze the reference points that we use to understand the anatomy of the joint we're treating in order to make the joint mobilizations. Instead, in the second part, we have the functional release that is made up of the trigger point and the myofascial techniques together. The approach to a trigger point, or at least what I usually do, is the direct ischemic compression. Instead, the myofascial technique foresees a sort of fusion between the joint mobilization and the trigger point technique. So we perform a joint mobilization combined to a compression on the muscles that are dysfunctioning and that are located in a certain joint. As for the first part, that is the joint mobilizations of all the joints, I would like to say why joint mobilizations are so important. Because if we asked our patients to flex and extend the knee, then of course everybody would do it. But if we asked a patient to mobilize a tibiofibular joint, then of course the patient wouldn't even know what it is. And this is why we need to go and focus on some joints that normally wouldn't be involved in a daily activity, and they might be dysfunctional, so we tend to use them little compared to other main joints, and this would end up undermining the whole movement of the joint.